In this section, we're going to be talking about hair and other specimen types. So hair has been used as a matrix to make a determination or help make a determination if there's been chronic and repetitive exposure to a drug or other substance. In postmortem forensic toxicology, especially with pediatric cases, there may be a request or the need to know if a child got into a drug one time accidentally, or if there had been ongoing administration of the drug. To do that interpretation, hair would be the specimen of choice. NMS Labs does have a hair collection kit that ideally should be used, but if not, then the hair should be collected or cut as close to the scalp as possible, and the root ends of the hair tied together so the orientation of the hair is kept. Hair grows about a centimeter a month in an adult, although there is variation with that, and depending upon the age of the child before they reach adult age, there certainly can be increased variation. But segmentation of the hair using the 1 centimeter a month formula can be used to segment and narrow down time frames of the hair, or the time frames that the hair would represent. The hair sample after collection can be stored at room temperature and shipped as such. If additional information is required about segmentation, taking into account the variability of hair growth rates, a toxicologist can be consulted. Other specimen types include toenails or fingernails in heavy metal cases or to make a determination about exposure to drugs. In utero, meconium, umbilical cord, or placenta can be collected and tested. Typically, the meconium and umbilical cord samples are collected for clinical testing, but they could have some forensic utility as well. The last specialty type of sample is when we have biological stains on clothing or other materials. Sometimes there's blood or gastric content or urine that's been soaked onto fabrics. That type of testing is possible, but does require what we call a forensic investigation and consultation with a toxicologist before proceeding with that. This type of testing is strictly qualitative in nature, so positive or none detected, but a toxicologist will be able to speak with you about the nature of your samples and the case itself to help provide guidance. Other specimen types that have not been mentioned in this presentation can be submitted for analysis, but please contact NMS Labs if that is the case.